One of the major research area in my lab is oncology or cancer research because it's such an important disease and really a big challenge for human health. In this research, we're trying to develop a new non-invasive test for monitoring cancer treatment responses. There's a lot of interventions into cancer therapeutics, and recent years, a huge or revolutionary method is called immunotherapy, which is using a person's own immune system to fight tumors. And although this is really important advances, and there's still limitations towards the immunotherapy field. For example, it's really hard to define responders versus non-responders. And it's very important to understand when the treatments start responding so that we can give the clinician the right information on whether we want to keep this research or we switch to a different treatment regimen. So our research is actually in this space. We're trying to make a diagnostics or make a treatment monitoring tool so that we can decide early on whether the treatment is responsive or not. I think the key innovation here, we're trying to leverage a lot of new state-of-the-art engineering tools to make this detection as non-invasive or as affordable as possible. Because what the COVID told us is the health resources inequity in many resources. And there's a large population of cancer patients in developing areas, in low resource areas, but it's very hard to get those precision engineering tools to healthcare practices. So that's the key motivation behind our research. So we're trying to develop those treatment monitoring tools that can be used in a low resource setting. So our dream is to make it as simple as an at-home pregnancy or COVID test. This is my very first faculty award from a private foundation. And the first really means a lot. And you can do it, especially for early career scientists. It's such a huge encouragement, and it's really make us confident about our research. And in practice, I was able to use the foundation award to not only support my research, but also support a relatively senior trainee, which is a postdoctoral fellow. We are doing a lot of those preclinical testing, and we need people with comprehensive skill tools. So that's a huge amount in terms of the human resources on my team. So I really appreciate this support that helped my lab take off. One thing that really inspired me was the research impact question file that I filled for the PhRMA Foundation application. And that's the time I really need to think a little bit bigger and think about those high-level questions. But I think that's very beneficial, especially for earlier career scientists, because you're framing the umbrella of your lab, you're framing the whole technological platform, and that's very important time to think about what's the bigger question and what's your vision and your mission. The short-term goal is making sure we do good research and we publish well and I can get my tenure. but long-term, I think I'm really inspired by those research focusing on the health equity to help all patients around the world. And I think we're eager to push our research proposal even beyond the PhRMA Foundation support, and we're eager to see good publications from it. And I think our eventual or a bigger goal is to see how can we leverage our precision engineering tools to help move healthcare practices forward.